welcome to ZUNMO Connect, where we unpack your organization, the Zambia Union of Nurses and Midwives Organization. Today, I'm delighted to take you through some of the projects and partnerships that have shaped who we are and continue to define our impact, both locally and internationally. Over the years, ZUNMO has worked hand in hand with partners who share our vision of empowering nurses and midwives through professional growth, leadership development, and community service. Our projects reflect our purpose, from continuing professional development to leadership training, from educational support for orphans to public health initiatives. ZUNMO's work is rooted in our dual mandate, which is advancing professional standards while protecting and promoting the welfare of our members. Through this initiative, we've invested in creating lasting infrastructure for our organization, including construction of a conference hall, and we are working towards establishing modern ZUNMO office building. We are also in the process of acquiring land at provincial levels, which other provinces have already acquired, ensuring ZUNMO's presence and accessibility across the country. To maintain excellence in practice, ZUNMO has been instrumental in providing opportunities for continuous professional development. As we've partnered with the Nursing and Midwifery Council of Zambia, making ZUNMO as a CPD provider, to ensure that our members, the nurses and midwives, renew their annual practicing certificate, and this ensures continuous learning and growth for our members. With support from partners like Clinton Health Access Initiative, CHAI, between 2017 and 2019, we developed, piloted, and launched 16 CPD modules in the areas of maternal health, nursing skills, child health, and wellness for nurses and midwives, ensuring every nurse and midwife has access to lifelong learning. Our strength lies in strong leadership. We have therefore continuously run the leadership capacity building projects, where we've seen training and orienting leaders at branch, district, provincial, and national levels happening. This keeps our leadership informed, empowered, and ready to serve. Recognizing the need for inclusivity, in 2024 we introduced the Boy Child Education Fund, supporting vulnerable boys who lost one or both parents who were ZUNMO members. While still young, the project is already restoring hope for the families. One of our most heartwarming programs supports orphaned daughters of nurses and midwives, giving them access to education and hope for a brighter future. The project has supported more than 100 girls, giving hope and opportunity for children of our departed colleagues. This is the project that inspired us to establish ZUNMO-supported project, which is the Boy Child Education Fund. The TB and MDR-TB project, which strengthened nursing capacity in TB care and prevention. Over the 15 years of the project from 2005 to 2020, which was part of the Lilly Foundation MDR-TB partnership, more than 100 ZUNMO members were trained in care and prevention of TB, as well as the treatment of people with TB and MDR-TB. Some even received the Leading Light Recognition Award for their dedication to fighting TB. This project began in 2004, and it brought learning resources directly to nurses, ensuring access to up-to-date health information. The Foundation for Evidence-Based Care, and also through the Leadership in Negotiation project, which is another project under ICN, young female nurses gained vital skills in negotiation, leadership, and advocacy. This strengthened ZUNMO's voice on national and international platforms. Today, we continue this journey under ICN's Ordena project, which is supported by Johnson & Johnson to strengthen organizational capacity and improve advocacy for nurses' rights and protection. Our long-standing partnership with the Norwegian Nurses Organization, or NNO, dates back decades. With the NNO, we've implemented impactful initiatives such as institutional and leadership capacity building project. This is the project that helped us transition into a stronger, more sustainable professional trade union. The HIV/AIDS program that built peer support network and improved infection prevention practices. The project connected nurses and midwives who were affected or infected, offering care, solidarity, and hope. Through the HIV/AIDS program, we came up with another project which was meant to support each other as carers, who are the nurses and midwives, either affected or infected. And the seed money was actually pushed into various provinces to come up with the income generating activities. And we saw that most provinces actually had tuck shops where they used to sell different merchandise, and those tuck shops up to date, they still stand. Other provinces and districts ventured into chicken rearing as well as some agriculture initiatives where they were generating some funds which would help the nurses and midwives or their families as they are affected or even infected. From that partnership also came the Wapula Acacias Education Fund, linking Norwegian nurses with Zambian nurses in caring for orphans in the province of Wapula, to be specific. Then there was also the Leadership and Sustainability Project. This one was implemented in 2016, where it had to enhance communication, especially through social media, making ZUNMO a more dynamic and responsive organization. The Royal College of Nursing, which is RCN, has also been a valued partner. Together, we've advanced initiatives like Safer Surgery Saves Lives, which trained nurses as well as other supporting staff in operating theaters countrywide in the use of the WHO Safe Surgery Checklist. In 2016, improving patient safety and surgical outcomes nationwide. So in that same year, the Nursing Partnership for Leadership and Improvement project reinforced ZUNMO's advocacy role as a professional body across all levels of healthcare. Most recently, this was from March to June 2025. As ZUNMO, we partnered with the Non-Governmental Gender Organizations Coordinating Council to bring health and hope to selected communities in Lusaka and Central Province. Through community drama, cervical and breast cancer screening and awareness sessions, we reached out to hundreds of women and men as well as youths with life-saving information on health and gender equity. Each of these projects tells a story of commitment and impact. We've built leadership, improved communication, expanded access to professional development, and most importantly, we've shown that nurses and midwives care for each other beyond service. ZUNMO proudly collaborates with partners at all levels. Locally, we collaborate with NGOCC and the Zambia Congress of Trade Union. Regionally, we collaborate with the African Nurses and Midwives Confederation, ANMC, Southern African Network for Nurses and Midwives, SANAM, and as well as Hexacon. Internationally, we collaborate with the Commonwealth Nurses and Midwives Federation, the CNMF, and the International Council of Nurses. These partnerships strengthen our voice, ensuring that ZUNMO continues to influence health policy and professional standards at every level. Each of these projects reflects our commitment to building an empowered, informed, and united nursing and midwifery workforce in Zambia. Together, we are not just shaping professional growth, we are touching lives, uplifting communities, and carrying forward the spirit of solidarity that defines who we are. Thank you for watching ZUNMO Connect. Don't forget to like, share, and subscribe to stay updated on our next episode, where we'll continue unpacking ZUNMO's story. Until next time, let's stay connected and keep the flame of service burning bright. Goodbye.